Now this you may have to click to start it. It takes a minute or about 30 seconds to get going. And then you click on this. Now watch the video.
What'd you do?
What are the questions?
I just wanted to sleep.
I'm calling an ambulance.
She knows house as well as any of us. She should have known she was waiting for him to do something he was never going to do.
Chase?
Hannah? You still with us?
What's wrong with her eyes?
Looks like REM.
What's that?
Rapid eye movements is what your eyes do when you're sleeping.
But she's awake.
Hannah! Hannah, can you hear me?
Yeah, of course.
Notice the color.
Get that to the lab and call a CDC.
Tell him what?
We have a patient with the plague.
The Black Plague?
Looks that way.
Plague's carried by rodents, not dogs.
Where there's dogs, there's fleas. If they hail from the southwest, then those fleas can't tell the difference between prairie dogs and puppy dogs. A small percentage of plague cases present with sleep disturbance. Imagine an idyllic river of bacteria. It's not idyllic for her, but it serves my purposes. The steroids and the immunosuppressants acted like a big honking dam across the river. Physics 101, put a dam up in front of a raging river, the river rises. By stopping the immunosuppressants, we blew up the dam, and a 100-foot wall of bacteria flooded her lymph nodes. We better find out where that dog is now. After you restart the immunosuppressants, and fill her up to the eyeballs with streptomycin, sulfate, gentamicin, and tetracycline. Use a garden hose if we got one. Get yourself some prophylactic treatments as well.
Now I clicked that. What the students would do is they would have to click this, and then they would have to answer the following questions as a critical thinking case. 1. Why did House tell the other doctors to call the CDC, Center for Disease Control? 2. What was the prophylactic treatment that House's team had to take? You need to include the dosage and the drug. And 3. Why did they have to take the treatment? For those that are in nursing, you probably know chuckle, chuckle, chuckle. Basically, for those that don't, he told the doctor to call CDC because plague is a reportable disease because it can be a critical epidemic disease. And it is always reported when there is a case out there. And as in this case, plague can be very, very nasty. If you want to do a little history, check into the Black Death and how it decimated Europe. The prophylactic treatment would be something to the effect of 500 milligrams of per body weight, the either Cipro or doxycycline, etc. And why did they have to take that? Because unfortunately what happens with bubonic plague is it turns to pneumonic plague, meaning that those bacteria go from the lymphatic system and become extremely virulent as they get into the lungs. As she coughed out, she's coughing out basically bubonic plague bacteria, pneumonic plague bacteria that are easily picked up by the other people, and therefore they need prophylactic, a preventative, before they themselves become sick. Now, I'm just giving you that as a cheat note. Basically, we don't tell the students. No, they're going to do the work. They're going to complete the answer in 3 to 5 complete sentences and include the bibliographic references for your sources.